Hi everyone, in this video I will talk about pre-shift anxiety going on to a nursing shift in the hospital. In this channel, I talk about all aspects of nursing. If you want to learn more about nursing, consider subscribing as I upload a new video every week. Also, be sure to give the video a thumbs up if you found it useful, as it helps others see the video as well. Nursing is stressful, and I feel this stress is even more heightened when you're working in a critical care area. Especially for me, being a relatively new emergency room nurse, I have anxiety going to each shift. This anxiety is built on the idea that there is so much to know and that anything can happen at any time. And my response to these sudden events are going to determine a person's health or life in many cases. Now, I've obviously been trained for my job, and it aims to prepare each person to ensure that they respond in an effective way. However, there's always uncertainty going into each shift, and there's something you learn working in a critical care environment every single day. And I think this anxiety goes on to other forms of nursing as well. My wife, who's a labor and delivery nurse, has been doing her job for 3 years now and continues to have anxiety each shift she has. This is because, again, her job is so unpredictable and she always fears for the worst. And this got me thinking about other people who are nurses. Do they have anxiety prior to going to their shift? How do they alleviate it or manage it? It was helpful for me to speak to my wife about it, as we are both nurses, but what if you don't have a spouse working in the healthcare field? It can be quite difficult to cope. It also got me thinking that this anxiety may actually be a good thing. When I was learning to work in the emergency department, I told one of my professors, the more I learn, the more I realize I don't know. And one of the things she said was this was normal and that everyone feels this way, and it is actually a good thing. She told me that it means that you know enough about this environment to always be cautious and look for areas where things can go wrong. She told me that the people that are the most comfortable are the ones that get into the most trouble, because they do not truly appreciate the insane amount of knowledge needed to make sure you do everything correctly. This feeling of anxiety is actually validated by many research articles. I recently read an article on situational anxiety amongst nurses, and in that study they mentioned how all nurses in all wards have moderate anxiety before and during their shift. They emphasize that there should be more done to alleviate anxiety. That got me thinking about coping mechanisms. The way I deal with this anxiety and stress is by exercising. However, ever since the pandemic started, I was very hesitant on going to the gym, and still am. But I've recently started to pick up exercising outdoors, and I found that to be helpful in easing some of the anxiety and stress after work. Oh, and by the way, the article that I read will be in the description box down below if you're interested in giving it a read. So I'm curious to know, if you're a nurse watching this, do you ever get anxiety going into your 12-hour shift? And if you do, I would love to know what type of nursing you do and how you cope with it. Thank you so much for watching, and I will see you in the next video.